everybody. This is Ask Dr. Bob, and this is where you get to ask me, Dr. Bob Gabbay, the Chief Scientific and Medical Officer here at the American Diabetes Association, your questions about diabetes. And each month, for those of you that are returning, we pick a topic and then sort of talk through that. This month, we're going to talk about type 2 diabetes prevention and a little bit about the treatment. If you like this, please tell your friends. And also, if you find this kind of information useful, I post things on LinkedIn, Twitter, Facebook that could also be of interest to you. So sign up, connect, and let's all learn together. So here are the questions on type 2 diabetes treatment and prevention. And let me just find these here, and I'm going to get started. So the first question is really a good level setting one, and it's sort of what's the difference between type 2 diabetes and type 1 diabetes? And I think this is important, so let's start with that. So I'll first tell you what type 1 is. So type 1 diabetes is an autoimmune disease, meaning the immune system is attacking the body's ability to produce insulin. It destroys the cells that make insulin, and really the only treatment, becomes insulin because the body's unable to make insulin and you need to replace it. And that's about 10% of all people with diabetes. So the vast majority of people with diabetes have type 2 diabetes, and that's what we're going to talk about today. And type 2 diabetes has two problems. One, the body becomes resistant to the effects of insulin. And a reminder, insulin is the hormone that controls blood glucose or blood sugar. So people become resistant to the effects of insulin, and that's problem number one. But for most people, that's okay because they're able to make extra insulin to compensate for that resistance. And so those people have insulin resistance, and there are problems associated with that. They have a higher risk of heart disease and things like that, but they don't have diabetes because they make that extra insulin. The second problem that people with type 2 diabetes develop is they can't make that extra insulin anymore. They can't make lots of extra insulin, so they're resistant. They can't make enough extra insulin. Their blood glucose levels go up, and they have type 2 diabetes. So that's the difference. Autoimmune in type 1 and two problems in type 2. So with that as the level setting, what factors predispose someone to type 2 diabetes? So that's a great one. And there are a number of factors that we know. Many of them are controllable, and then some are not. So let me tell you about that. So probably the biggest factor that predisposes to type 2 diabetes is having obesity. And that's defined really based on a body mass index. And that's a calculation that you can do based on your height and weight. You can find places on the web where you can just calculate that quickly. And there's an overweight range, and there's a range that's considered obesity. And so obesity is probably the biggest risk factor for developing type 2 diabetes. A sedentary lifestyle is another one. And then another one is something we can't do anything about, and that's our family history. So if someone in your family has type 2 diabetes, that increases your risk. So those are the ones that people tend to think about most in terms of developing type 2 diabetes. But there's some others that we know about now that you may not know about. So smoking increases the risk of developing diabetes. Not having either enough sleep or too much sleep can also increase the risk of diabetes, and alcohol can increase the risk of diabetes. And then we know that certain populations are at higher risk for developing diabetes. Uh, Black African Americans, Latino, Latinx, Hispanics, Pacific Islanders, Asian Americans are all at increased risk for developing type 2 diabetes. Interestingly, and this is one of the things that I like, is that caffeine actually lowers your risk of type 2 diabetes. And being a big coffee person, that's sort of good news for me. So, the best way to know what your risk is for type 2 diabetes is to go to the American Diabetes Association website, diabetes.org/risk test. And there is a risk test. It's a series of questions you can answer about yourself, and it will tell you what your risk is for type 2 diabetes. So I really encourage you to go to the risk test. It's the ADA risk test. You can find it easily. So one thing else I should mention is that for people that are very high risk for developing type 2 diabetes, there's an intermediate stage called pre-diabetes. And that 80% of the people with pre-diabetes don't know they have it. So that's a good reason for you to go see on the risk test whether you are at risk. And we'll talk a little bit about how you can know whether you have pre-diabetes. Oh, one other important risk factor I forgot to mention, and that is a woman that has had gestational diabetes, diabetes during pregnancy. They're at very high risk for developing type 2 diabetes. In fact, if a woman has had diabetes during pregnancy, half of those women will develop diabetes in the next 10 years. So really high risk factor. Okay, so we talked about the risk factors, and then the natural question is what can be done to prevent type 2 diabetes? Is there anything that can be done? And it turns out, yes. We know a lot about how to prevent type 2 diabetes. So let me tell you about that. Really maintaining a normal body weight and physical activity are the two big ones. And we know even more about that. So if, for example, you have prediabetes, of which there are almost 100 million Americans with prediabetes, if you have prediabetes, all you have to do is lose 7% of your body weight. So think about how much you weigh, and then multiply that by 0.07. You can use a calculator, or you can find that on the web. That's enough to lower your risk of diabetes by 2/3. And that's based on a program that helps people lose weight to do that. And that program is called the Diabetes Prevention Program. And you can find information from the American Diabetes Association about that. The Diabetes Prevention Program has been studied as a method for people to lose that weight, and it works, and lower the risk of diabetes by 60%. And what's involved, you may ask, it's some increase in your physical activity, and that's really walking 150 minutes a week. That's doable. That's not so far off. So one of the exciting things the American Diabetes Association is doing is that we've gotten been funded by the Center for Disease Control to take this diabetes prevention program that's been shown to reduce the risk of developing diabetes by 60%. We're going to take that program and scale it across 6 states in the diabetes belt. So if you live in one of these states, Texas, Louisiana, Mississippi, Alabama, Florida, or North Carolina, stay tuned, because we're going to be doing some exciting work and offering some free resources to you to help ensure that you don't develop diabetes. So stay tuned for that. So let me go back to the next set of questions here. and so the next thing is sort of how is type 2 diabetes diagnosed? And the good news here is that it's very easy to diagnose with diabetes. It's a simple blood test, and the easiest way is to just get an A1C test, and you can ask your healthcare professional. Anyone over the age of 35 should be screened. And some people younger than 35, if they have some of the risk factors I talked about, should also be screened. And that screening A1C will tell you not only if you have diabetes, but also if you have pre-diabetes and whether you need to do some things to prevent diabetes. So easy to do, get an A1C. If you're over 35, you should be getting one every 3 years at a minimum. What are the signs and symptoms is the next question of type 2 diabetes. And for most people, there are no symptoms. And that's why it's important to get screened, because you may not know that you have diabetes. And so this is, for those of you listening, this is not only for you, but also for your loved ones. If they're over 35, they should be screened with that A1C test. Sometimes people can have excessive urination, excessive thirst, their weight can be dropping, they can have blurry vision, women can develop vaginal yeast infections. Those can be some of the signs, but as I said many times, no symptoms at all. And then another important question is, can it ever go away? So if I have type 2 diabetes, can it ever go away? And here's where the words we choose carefully. We don't say that people no longer have diabetes, but they're in remission. And why do we say remission? Why is that wording important? Because you can go into remission, but it's important that you continue to be screened for the complications of diabetes, because even though you're in remission and have normal blood glucose, you may still be at risk for some of the complications. And so we'll talk about the screening in a moment. So is it possible to go into remission? And yes, and typically that involves weight loss for most people. And so if you're able to lose weight, you can sometimes go into remission, meaning you don't need any medications and you have normal blood glucose. So the next question, we're going to move from prevention and diagnosis into treatment. So how is type 2 diabetes treated? And this is really, I'm just going to give you a broad overview of this, but we'll in other sessions get into the deeper parts of this. But there are really different medications that can be used. Some are tablets, some are injectable, and the treatments are really getting at the causes of type 2 diabetes. And so at the beginning, I said it was two problems, right? It was resistance to insulin and not making enough insulin to overcome it. Well, the treatments are largely aimed at that. So we have medications that help with resistance to insulin. Weight loss really helps that. Physical activity makes you more sensitive to insulin. And then medications like metformin make you more sensitive to insulin. Then there's ways to help you make more insulin. And there are injectable medications, the GLP-1 drugs, that also help with weight loss. Those can work. They have names like Ozempic and Trulicity and Mounjaro, Victoza. There are a number of these medicines in these class. They help you make more insulin. And then there are older drugs that help you make more insulin: glyburide, glipizide, glucotrol, Amaryl, glimepiride. You may have heard of some of those. So they're tablets, they're injectables. And then it's important that you watch your diet. Meeting with a dietitian is really helpful. A certified diabetes care and education specialist can give you all of this information. For many people, reducing their carbohydrate intake can be helpful, and really trying to lose weight in a variety of strategies. And people often ask me, what's the best way to lose weight? And what I often say is, have you ever tried to lose weight before and been successful? Most people have done that for some period of time and it's worked. Well, whatever you did is probably the thing that works for you. And so think about that. And then uh, the next question are what are the common complications of type 2 diabetes? So if type 2 diabetes is not managed effectively, people can develop blindness, kidney failure, amputations, stroke, and increased heart disease. The good news is that most of these really they can largely be prevented. I'm going to tell you how in a moment. But I want to tell you one other complication of type 2 diabetes that people don't think about, but we're now learning is really important, and that's liver disease. And maybe one of these sessions we'll talk more about liver disease and diabetes. So the other question is how can you prevent these complications? And the good news is that you can, and it's the ABCs. And so what do I mean by the ABCs? A1C. So that's a measure of your blood sugar control, your glucose control, getting that to the right range. B, blood pressure, getting your blood pressure to healthy range, less than 130/80. And C for cholesterol, getting your cholesterol down to the right levels. So talk to your healthcare professional about what the right goals are for you, but A1C, blood pressure, cholesterol, ABC. And then the other way to prevent complications is to catch them early. And so it's screening for those early complications. For eye disease, it's getting a yearly eye exam. For kidney disease, it's a simple urine test and blood test. And for heart disease, it's making sure your cholesterol is good. And for amputation prevention, it's having your feet checked. And so those are all early ways to prevent complications. So finally, I've given you a lot of information here. What if you want to learn more? Well, the best place to go is to diabetes.org, to the American Diabetes Association website. We have everything I talked about there, plus more. There's also the risk test at diabetes.org/risk test. Again, you can find that on our website. It'll tell you whether you're at risk for developing diabetes. And then we also have our food hub that has lots of recipes that are diabetes friendly that you can take a look at. So we talked a lot today about preventing diabetes. Diabetes is preventable. There are a number of risk factors. Go take the risk test or have your family members do it. If you're over 35, you should get an A1C test to see whether you have diabetes or not, and whether you have pre-diabetes. And if you have pre-diabetes, think about the diabetes prevention program as a great way to prevent diabetes. Go to our website for more information. If you found this helpful, please tell other people about it. We want to spread the word as much as we can. Also, follow me on LinkedIn, Facebook, Twitter, and I'll be sending other information out. And so until next month, where we'll cover a new topic,